Hey, good day, everyone. I'm Dr. Paul Pepe, and I've been asked to talk about COVID-19 as a cause of cardiac arrest. Um, I think most of you've heard that there's been a severe escalation of out-of-hospital cardiac arrest during this SARS epidemic, and I'm going to try to give you my perspectives on it as we go through this. First of all, this is another curious COVID-caused confounding clinical complication, and I think you'll find it kind of interesting as we go through this. By the way, I have no disclosures or conflict of interest to declare, and as many have heard me before, the only real thing I have to disclose is that I'm not a morning person, so I'm glad to be able to do this virtual talk for you. I've had a bunch of people that have helped me with work over the past year, but with the COVID crisis, I've been now designated a non-essential person, and so I hope you can tolerate me in that particular venue and position here. But one of the things that I have been able to do is develop a collaboration of all the jurisdictional medical directors of the 911 systems in the United States, 112 in Europe, 999 in UK, and so on, and 000 in Australia. And it's been very interesting to see what's happening on those various areas. So we actually keep track, talk to each other twice weekly and long webinars that really have been instructive. So it's been kind of neat. So we wanted to know if things are the same, are they unique, are they different? So this actually has been written up. The group has got kind of a nickname called the Eagles. And there's been some very interesting things that we came up. Our first meeting was actually as early as mid-February. And there's been a lot of great information. It's kept everybody a few weeks ahead of the curve, and it's been fun. So one of the things is about EMS call volumes worldwide. I can report safely that Antarctica has not had one single case of COVID-19, but we'll see how that goes. One of the first things that happened, interestingly, that we heard a report from Roberto Fumagalli from Milano, is that within days, the worried well were just calling and overwhelming the public safety answering point. In fact, the call volume here went up 264% to EMS on day 3. As you can see, this is when they had the first case announced, and within days people were just calling up. Eventually they got that under control as they started going into not only public education, but also they had a shutdown, where people were basically they're going to be staying home. But that happened much later on March 8th. This is the first week or two after this event. So that was interesting. But the other thing that we were beginning to find out was that after the lockdowns, which happened in Europe, let's say as early March, in the US, mid-March, etc., is that when that happened, the worldwide, we saw that emergency department visits went way down. In fact, EMS call volumes went way down. And that was really striking, and particularly in the area of trauma care. But what was fascinating was this, is that the cardiac arrest numbers went up. Or what is that just relatively mean going up because there was decreased calls, so it's larger? But no, they said in terms of absolute numbers, the call volumes went up compared to previous years. So one of the first reports, of course, came out of our friends in Lombardia in Italy. I was just describing that. And what they found was that it was pretty dramatic, that as the COVID cases went up, their cardiac arrest cases went up as well. So I think that's important to note. This is the whole area of Lombardy. And then this red line here is the number of cases in which COVID cases were documented here. Of course, keep that in mind what that means. But still, relatively speaking, it was going up. You could see that the number of cardiac arrest cases they had the prior year is given in the this brown color, out of hospital cardiac arrest. And you can see there were much more as you went on out to by the end of the month. They were just a larger number that they were having during that period of time. And this is days since February 20th and cumulative cases. I think the take home point is that if you look at this, is that the number of cardiac arrest cases was greater than what had happened the year before. So that's interesting. And we're going to come back. You're going to find out it's actually more interesting, but I won't focus on that at this current time. New York City also reported that and that was the epicenter as well in the United States, and they started reporting that their cardiac arrest cases were just skyrocketing there. In fact, they were reporting that they were going up almost, as much as one day on April 6th, the out-of-hospital cardiac arrest peaked at 305 cases, which was nearly a tenfold increase from the prior year. I mean, it was very interesting. So the other thing that was interesting was the nature of the cases, as we'll get to that in just a few minutes. So why was this happening? So the first theory was that people with acute coronary syndromes remained at home afraid to be exposed to COVID-19. So they're having their chest pain or whatever, then they had their cardiac arrest, and that was it. A secondary theory is that since COVID-19 causes hyperclotting, which I'll talk about in a little while, some were getting pulmonary emboli, okay? And so that could be a thing. They had a big pulmonary embolus and they had a cardiac arrest, and that was it. And there's something to that in the sense that in New York City, a large part of what they saw were people that were ACEs. They were not in ventricular fibrillation. They were asystolic, or they had, pulsus electrical activity, so to speak, as they call it. And so it was interesting. Maybe not arrhythmias, maybe it was something else. Maybe it is the hyperclotting. So the third proposition, which I'm actually going to support, as you'll see, is that some other direct complication of COVID-19. So there's a paper I'm putting out, and I got to block the data. It comes from that Eagles group, the jurisdictional medical directors. And we looked at, for example, just in this particular thing we've had accepted and it's embargoed, all I can tell you is that it went up dramatically. But the interesting thing is that in the cities where it really got hit hard, like New York, you saw this huge jump in cases. But now in June, after they got in control, what's happened is that they have basically gone down to their normal level. Meanwhile, cities that didn't get attacked that much, every place from Perth, Australia, to Albuquerque, New Mexico, some others, those places essentially didn't have that increase. If anything, they had kind of a decrease. And so what was interesting is this thing went along with how much the attack had in your city. And now places like Phoenix and, let's say, Madison, Wisconsin, have gone way up now that in Charleston, South Carolina, now that the cases have invaded their area. And remember, before, they were all in lockdown before. So it's not that, I don't believe that the case there was that they were in lockdown and getting into trouble. They were basically having an impact from the COVID. Now, was the COVID something due to hypercoagulability issues or whatever? And by the way, let me just tell you, going back to the Lombardy area, I do show you this, is that if you look at this chart, this is the amount of cases that you're noting. And looking at this city here, the attack rate wasn't as high, whereas, and there's therefore the number of cases, the difference between 2019 and 2020 wasn't that significant. Same thing over here. Oh, sorry about that. Same thing over here in this area as well. So if you break it down to Pavia, Mantua, they didn't get hit as hard, whereas these areas got hit hard, such as Lodi, and you can see in Lodi that they basically had a high number, so they have much more cardiac arrest. So I think that they're seeing what we were seeing as well. So why? So the theory was that people with the coronary artery syndromes, the hyperclotting, et cetera, are also direct, as I said before. Well, I think we need to step away from the conventional thinking, and this thing has been unprecedented in many ways. One paper I did write early on was spotting the clotting and noting that we did have hypercoagulability, which made me think, is it a pulmonary embolus? We were seeing it on autopsy reports, et cetera. But the other thing is, this thing causes a mass inflammation, a cytokine storm, but it's an endotheliopathy that starts all this out. And so we see the pleuritis and the pneumonitis, the encephalitis, meningitis, et cetera, et cetera. One of the things I'm going to say is that we get myocarditis and arrhythmias have been seen, but I think this may be underlying endotheliopathy in the microcirculation. It causes the problems there. We're seeing people who are now maybe having a Brady asystolic arrest. And we don't know this for a fact, but my speculation is that's part of it. Now, it could be pulmonary emboli, it could be people staying at home, but a major part of this, I think, is a direct impact from that. More recently, I've done some studies using TEG, and what we're finding is that a lot of these folks have a platelet diathesis. And so, when we use thermal elastography, TEG with platelet mapping, we're finding out that it is a platelet problem. And I think a lot of this is happening in the microcirculation, that has been shown really well now on autopsy reports. And you guys are smarter than me about this, and you know that. So I'm just trying to give my own explanation to this. So in conclusion, COVID kills. So please stay safe. Thank you very much, everyone.